All right, it's now 1 o'clock. This is Seneca County Public Relations Coordinator Jimmy Flynn. I'd like to welcome all of you for and thank you for coming aboard here for our press conference with Seneca County Health Commissioner Beth Schweitzer and Seneca County EMA Director John Spar. And without further ado, go ahead and push it over to Beth. You can go ahead and get started.
Good afternoon, Seneca County, and we're glad to be here today again in our slightly different format as a press conference, which is very similar to what we've been doing with the podcasts quite a while, but this gives an opportunity for press to join us and ask questions if they have any. Just want to update you on the COVID situation here in Seneca County, as well as where we are in vaccinations. And as of last evening, we had a total of 4,487 cases of COVID. That was only an increase of 26 cases from Monday. So that was a very good thing to see that we did not have a big increase. We have noticed a slowing of cases over the last few weeks. Every once in a while, we'll have a day where it pops up there higher than we'd like to see. Hoping that this is a trend, and I'd like to be optimistic, yet don't want to get overly optimistic, so that if we do seem to have a surge, we will not let our guard down. We have a total of 260 cases of those that are active, 38 hospitalized, and unfortunately the total of 116 deaths here in the county since this started, which now has been, it's been a little over a year since that first case was diagnosed here in the United States. So we definitely are a year into the pandemic. And luckily, being able to provide some vaccine this early on, since the last week of December, we have been providing vaccinations to the citizens of Seneca County based upon the tiers which have been developed by the Ohio Department of Health along with Governor DeWine's administration. And as I look around the nation and see what's happening, I know it's been tough for the tiers to be assigned. Everyone is very deserving, but there is a method to how those tiers have been chosen. And I think it's a much more systematic, well-organized situation than it is in some other places throughout the country. We have given over 100 vaccinations here at the health department. With the second doses coming this week, starting this week, for those who were first immunized that last week of December, 4 weeks ago. And also, as we have been doing the last week or so, actually more than that, we have also been scheduling appointments for those who are 80 plus. We had a very successful clinic on Saturday out at the Opportunity Center. It was truly a joining of many entities to help make that happen. The Opportunity Center offered their assistance by offering their building, which worked very well. Lou Hurst, the superintendent, Julie Shellhouse, one of his assistants, who helped us organize, were there the entire day helping us. We had students from Sentinel Career Center, the public safety students helped people park, got them to the door safely, provided wheelchairs for them if they needed it. And then the Sentinel Health Professions students assisted people with filling out their paperwork before they went on to get their vaccinations. The vaccinators included many, many community volunteers giving their time to help us do this, as well as other community volunteers who talked to people after they were done, watched them for the 15 minutes that's required for people to stay, just to make sure there are no severe side effects, and which I'm happy to say we have had none. Very minimal side effects for most people, as we did expect. So that's a very good thing. We were informed earlier this week that the allocations for this coming week, next week, could be lower than they have been. One of the reasons is they are diverting some of the stock of vaccines to go to schools. That's starting next week. The health department here, we will not be receiving an allotment next week. We do have some on hand that we are going to be distributing this week and probably into the beginning of next week. We also have both the Kroger stores, one in Tiffin, one in Fostoria, as well as Mercy Hospital here in Tiffin providing vaccinations. They each are also getting an allotment of 100 doses next week. I know that many of you have called and left your names at the health department to be on the list to receive the vaccination. And I know people are wondering if their call came through, if they are going to get a call back, when they're going to get a call back. I must tell you, the response has been overwhelming. We have over 3,000 people on our list right now, and we do have them logged according to the time they either called in or filled out the application online. So we are working through that. If you tried to call the health department, or if you've received a call from the health department in the past day, a new phone system was installed Monday for county offices. And unfortunately, sometimes as when you have an installation, have new equipment, there's just some bugs that need to be worked out. So my apologies if you've not been able to get through for some reason to the health department since Monday. Also, some calls have gone out that do not have us listed as the caller. So I would just suggest, if you've been expecting a call, please go ahead and answer. We have had times where we have not gotten answers when we've called people back, and we unfortunately just do not have the capability of leaving a message, waiting for people to return our call to hold that spot for them. We do move on to the next person on the list. So be aware, keep your cell phone close by, or keep someone close by your phone at home if at all possible, so that when we do call, we can get you scheduled. One of the things I wanted to mention is that yesterday in the press conference, we learned that the Ohio Department of Health has recommended that the curfew be amended. The governor has considered this, and what was announced was that it will be dropped from the curfew from just 11 p.m. at night to 5 a.m. in the morning, should we have hospitalizations that fall below the number of 3,500 for 7 days in a row. If that happened today, that would be the 7th day. So they will lower that, reduce that amount of curfew time for at least 2 weeks. That will be amended tomorrow if that occurs today. And the curfew will be in effect then from 11 p.m. to 5 a.m. for at least 2 weeks. If the hospitalization utilization falls below 3,000 a day for 7 days, 7 consecutive days, then the governor will drop that curfew, and it will be just 12 midnight until 5 a.m. for a period of at least 2 weeks. Now, if the hospitalizations bounce back up at any point, if that number seems to be rising quickly, the health officials could reinstitute the appropriate curfew measures, and thereby lengthening a little bit. So that is something new that's on the horizon. Hopefully a step in the direction that we're all wanting to go. And we will continue to keep you informed about where we are with immunizations, and just hang on, we'll be with you as soon as we can. And now I'd like to turn it over to my partner, John Spar, with the Emergency Management Agency here in Seneca County. John, welcome.
There we go. I did. Okay, thanks, Beth. Now that I'm unmuted, our office is continuing to support the efforts of the health department in their PPE donation center, and with whatever we did, help them with the drive-through testing, and we assisted last weekend with the clinic, the vaccination clinic. And everything, I spoke to somebody on the phone this morning who called our office to ask questions about vaccines, and they expressed how pleased they were on how Seneca County was handling this, and doing the best you can under the circumstances, even though they're still waiting for their vaccine. They're aware that it's a waiting game. And we'd ask that everybody do that. Be patient, and if you have questions, feel free to give my office a call. If you can't, especially if you can't get through to the health department, we're working hand in hand. And any questions that I can't answer, I can certainly find an answer for you and get back to you. Going to the website for the EMA, Seneca County Emergency Management Agency, which is senecacountyema.org, will get you some resources, and double some of the items that are on the health department's website as well. For example, you can register yourself for a vaccine on our website. It takes you to the same place as the health department's. Also, there's some resources there for COVID-19. I don't have much else to pass along right now. I'm certainly open to questions.
Great, thanks to both of you. I want to start off, I'm going to go to Vicki Johnson here from the Advertiser Tribune. If she has any questions, we'll give her the first shot at it. If not, I've got a few questions online. Vicki, do you have anything? And sorry, Vicki, you should be able to unmute now if you want to speak.
There we go. Are we still on the 80 plus then? You're muted, Beth. You're muted, Beth.
My
There you go.
apologies. Yes, we are still calling 80 plus as we got quite a few done, but we still have many, many more. I will let you know, and I'll let you know through Vicki, through you, the paper, through the radio, when we think we will go ahead and open up to include the lower ages. We will do that fairly soon, but we do want to try to get the bulk of that 80 plus done, or at least well under our belts.
Okay.
Great. Do you have any other questions, Vicki?
Do you know how many you've done so far? I mean,
Not counting the second doses, our count Monday before we started the second doses was 1,068 is how many we have done. So that does not include, of course, the 300.
1068.
1068, yes.
Okay. And that's everybody, the EMA.
That includes
EMTs and
the
everything?
tier ones,
People.
yes, that we
Okay.
did.
All right.
Awesome. Okay. Anything else from you, Vicki?
That's all I can think of right now.
Perfect. Okay, so I've got a few questions for you, Beth. I'm actually going to mute you so we don't get any feedback here, so make sure and unmute when you answer the question. But I wanted to ask you from the chat, there was a few different questions. One was about the phone system. We'd mentioned there's some technical issues going on with that, so we can move on from that. We are working on that. We're not sure when that's going to be fixed, but with technology, moving the phone lines over, sometimes there are some hiccups. So bear with us if you don't get through. Try again later in the day or tomorrow. So the first question, it's a person who asked, they called back in December, they've not heard anything. What would your advice be to that person? Kind of go through the scenarios for them.
They say they called back in December.
Yes.
You could tell you what, I will have you message our Facebook. And we can look and see if your name is actually on the list. We'll have to be careful with this. I kind of hesitated to say that only because I don't want that to become overwhelming too. And I know it upset people back in December when we were overwhelmed with calls, not expecting there to be quite that many. And we did have to ask people for the time being, please stop doing that. So we will let you know if it just becomes more than we can handle right now. But if it was that long ago, I would be glad to look and see if you in fact are on the list.
Great. The next question from Linda Auger. She says that if someone over 75 called and left a message earlier for their name to be on the list, and now they have an appointment through Kroger, should they call your office to be removed from the Seneca County Health Department list?
You know what, I would say, don't worry about it, what happened. And I know this is going to take a little more time, but still we like to check in with everyone who called. As we go down the list, we had this happen last week as we were calling people to come to the clinic on Saturday. So all it takes is a quick, no, I don't need my shot. I was provided with it, and let us know.
Great. Now, I think there's been some confusion out there because people are looking at the dates that the governor's putting out and they're saying, oh, this is when you move to the 75.
Yes, and he has mentioned that was a guideline, or this is what, depending, all counties are a little different depending on how much vaccine they're getting, how many providers they have in their county that are also providing vaccines. So it is a way to say this is a point where you can open up. It does not necessarily mean that, oh yes, now we'll start definitely doing that age group this week. It might be another week or two before that starts.
Great. And can you talk about, I know last week you talked, or 2 weeks ago when we did this, you mentioned that there was a limited amount of vaccines available here in Seneca County. And, in that 80 plus group, I think you said there were maybe, do you remember the number? Maybe 1,500 or it was
2,500 actually,
2,500.
80 plus is according to the updated 2015, the by census.
So the question from one of the viewers was, why haven't you gone to 75 plus yet? And I think that's the answer. Can you talk about that a little bit?
Well, we still have so many on the list that are the 80 plus.
Great. And this is a repeat question from last week, but I want you to answer it again because I think it's a good one. And I'd also like to apologize. We're having some internet connection issues, so I'm kind of bouncing in and out here. So if I do, I'll send it back to Beth. But the question is, do you have to be a Seneca County resident or a resident of the county that you're in to be able to get an appointment through that health department?
Not necessarily. We are asking people as much as you can to please stay within your county. But if you are, for some reason, you're visiting your son or daughter, maybe an older person, and you're going to be here for several months. Sometimes I know parents will come live with their children for a period of months. Or if you work in the county and it just ends up being more convenient, I think it's going to be more equitable distribution if we do ask people as much as possible to stay within their own county. But if it's a virtual impossibility for you to do that there, then we certainly are not opposed. We're not going to turn folks away. But I think you're probably going to get served as quickly if staying in your own county as you are going outside of the county.
Okay, and I think this will be the last one. Then we'll give Vicki one more chance if she has any follow-up questions. But this person says they're 66. Should they go ahead and get on the list? How do they do that?
If they would like to, there is a registration form, as John mentioned, on the EMA's website and on our website that people can go ahead and get online and register. And as I said, that has a timestamp. And of course, when we receive our calls, we note what time those came in, and then they feed into a database which intermeshes. So you can do it either way and be assured that you will not get on more quickly or lag behind because of one method or the other.
Absolutely. And just to kind of back up what you're saying there, one of the questions I see online a lot is, I called, I left a message. How do I know for sure that I'm on the list? If you don't think that your message got through when you called, I would advise you to go online, fill out the form either on the EMA website or the health department website. And then if there's duplicates, we can go back and we can remove those.
Yes, and we will find duplicates. So yes, that's a very good recommendation, Jimmy. Appreciate that.
Yep, no problem. So that's, just for the people who, you called, you're not entirely sure if you got through, the first thing is if you left a message on the voicemail, that means you're on the list. But if you don't trust that, go online, fill out the sheet, and you can go from there. So, okay, that's great. I'd like to thank everyone for joining us. Vicki, do you have any follow-up questions after listening to all of that?
Yes, I do. I have one. It's not really vaccine related, but I had a question come into my email, so I might as well ask it here for everybody else. One man asked about the discrepancy between the number of deaths reported by the health department and the number reported on the Ohio Health Department website.
Yes.
Could you explain that, please?
Yes. We have mentioned before, because that of course does come up. The state does not get death certificates for quite a while. And of course, we have them more quickly here within the county than the state health department gets those, that they can be recorded. But also our nurses and contact tracers, you kind of begin to know your people, who the names of people who are COVID cases. And so when we see a death and have been reported a death to us, and we do find those out quickly when we are calling people, because we always check in with our hospitalized people to see how they're doing. We also like to close cases, find out that someone has recovered. So in those methods, we do find there are deaths that have not yet been recorded at the state. So that's why the number is higher here than it is down at the state. While I'm on, I want to mention something too. I just want to throw a shout out, and I mentioned volunteers. I want to mention Dale Depew. He has just really been a help to us during this. He was instrumental in getting volunteers for our drive-through clinic, or drive-through testing event, which was great. He had local food merchants who donated food for the volunteers to have to eat that day. And I want to throw a thanks out to John Spar, because he too was instrumental in getting that testing event done. I just basically was a bystander, which was kind of nice for a change. So I sure appreciated that. And I know our community is really, just something about our community is so great that people step up to the plate when it's needed. And you don't know how much we do appreciate that.
Beth, I'm just going to stay over here because my computer's having problems. Someone asked, and I think this goes back to the phone issues, but wondering why you can't leave a voicemail. And if I registered online, will I receive a call or an email?
If you registered online, we will call because we want to, of course, be able to give you the time and find out too if by chance you've already received that vaccine.
It just might be a matter of time, right?
Yeah, not leaving a message. That right now has to be with the new phone system. And I know there were some settings that the limit for a while, we would have many, I mean, over 200 calls sitting on the line, even though our mailbox said it was full. With the new system, let me check that out and see if there is a limit on, usually there is a limit in the number of messages that can be left before it tells you that the mailbox is full. So I will double check on why that is happening, that you're not able to leave a message.
Right. And if you haven't signed up, you can, again, go to the website, either senecacountyema.org. Is it .org, John? I want to make sure I got that right. Okay,
Yep.
senecacountyema.org, or you can go to the health department's website and you can sign up if you feel like, you know, there's something wrong with the phones today. You can obviously try back again, or I would say go ahead and go on and do the online form. So, all right. Any final comments here from Beth or John?
No, I'd like to thank Dale Depew as well, and this is for something separate. The state sent us about a pallet and a half, 30 cases of masks that were for anybody. They were called Do the Most Good masks. They're surgical masks, and Dale was willing to take up the mantle and take those off our hands to distribute to businesses, individuals, etc. And for more information on how to get a hold of some of those masks, you can check out the Seneca News Daily. They have a link there for sending him an email with what you need, and they'll get you those masks. Otherwise, the donation center at the Public Safety Building is handling what's known as the Tier 1 FEMA group, which is healthcare workers and hospitals and firefighters and EMTs, et cetera. So that's what the rest of our donations have been for. Thank you.
That's great. And Beth, I've got a bonus question for you. I didn't want to leave out Helen, who asked, why can't the health department leave a voicemail when calling to schedule? You know, I'm guessing it just playing phone tag. We just don't have the time for that. But can you answer that question?
Well, if we leave the message, we do go on, and we don't know when someone's going to get back with us. So we do go on. We need to get those schedules filled. As you know, we have a certain number of doses. We have to use those within a certain time. They are asking us to be as conscious as possible of getting the vaccines into the arms as quickly as possible after we receive it. I did leave some messages when I was doing it, but found, unfortunately, it did not work real well, because if you try to call back to schedule, then you may not get through right away. Plus, we may not hear that before the time we need to actually hold the clinic. And we do need to use that vaccine when we have it scheduled. So there's the concern, we don't want to waste it.
Makes sense. Okay, well, I think that's it for questions that I see right now. I'd like to thank everyone for joining us, and especially thank Beth Schweitzer and John Spar, our health commissioner and our EMA director, respectively. We'll probably be putting another one of these things together here in the next couple of weeks or so, and when we do that, we'll make sure we post that on social media and share that with our friends in the media. So thanks again for joining us, and until next time, take care and be safe.
Thank you.
Thanks for coming, Vicki.